Wait. Sorry, I'm just getting my
Okay.
take notes.
Chris Seifer, why are there two of you?
Let's see for why are they?
Oh. There's Ruth.
There's Ruth. I see Jim. Ruth, David. I see Maria. Is Terry Guerrero on? I see
No,
Dawn.
not yet.
Kathy Bishop's here.
Maybe Chris is having trouble unmuting. I see her on there twice.
We see two of you, period.
Kathy Bishop's on.
Hi, Dr. Bishop.
How are you?
Good.
How are you?
I'm doing all right. How are you guys?
Little cold this morning.
Oh, I'm telling you, it was like -10 when I left home.
Is your road plowed at all?
They actually plowed it enough to leave some snow on it, so was not just pure ice, which was good.
That's a good thing.
Okay, we are streaming, so we don't know what's going on with Chris, though, right?
No, I'm gonna put you on hold for a minute. I might just have Mr.
Yeah.
DeGeorge either phone in or be sitting behind.
Yeah, put him in the corner there.
All
All right, I'm going to mute everybody until we're ready. So. Okay, Chris, I think we're ready to start. Okay. Good afternoon, everyone, and welcome to the February 17th, 2021 meeting of the Board of Health. I'm going to call a roll. Don't forget to unmute your mics if you have them on mute when I call your name. So first, Christine Seifert.
Present.
Maria Fowler.
Here.
David DeGeorge.
Here.
Ruth Simon.
Here.
Dr. Bishop.
Here.
And we are missing Mr. Guerrero right now. We also have with us Christine Hill, our director, and we'll have other staff members coming on in a moment here. So we have established a quorum. Next, I will entertain a motion to accept the minutes from our previous meeting.
So moved.
Second.
Second.
Okay, got a motion by Maria, second by Ruth. Any further discussion? All in favor say aye.
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 Any opposed? Motion carried. And Mr. Guerrero did just get on, so welcome Terry to the meeting. Next, we will have our environmental health report. Is Terry available? There we go.
Nursing ahead because we have a clinic, if that's okay with everyone.
Say that again.
She's requesting that nursing give their report
Okay.
because they have a clinic that they have to get to.
All right, we'll go on to nursing. Peggy and Colleen.
So you have all in your hands the nursing report for January 2021. Yes, someone. So we did 760 Moderna COVID-19 vaccines for January. Let's see, clinical disease reports are listed. And then, most of our time is consumed with the daily isolation and quarantine, as well as the vaccine clinics that we are doing some days, some weeks, 7 days a week. Anybody have any questions on the nursing report?
Well, I just want, while I have you nurses, how much time do we have? When do you have to leave?
We should stay till a little after 2.
Okay, so I do think, Peggy and Colleen, that we should talk a little bit. I mean, you're talking about your time being spent in vaccine clinics. I think you should spend a little time talking about, priority groups, waiting lists, and the VMS.
So we are following the Ohio Department of Health guidance on what groups are to be vaccinated. We still have some phase 1As that we're sprinkling in here and there. 1B is 65 and over, but it has been tiered out. So the first week that it opened up, it was 80 and over. Then the following week, 75 and over. The following week, 70 and over. And the following week, 65 and over. Included in the 1B rollout is also people with severe congenital early onset, meaning an illness that developed in childhood, and developmental disorders, with intellectual developmental disorders. So you can have a congenital developmental disability without an intellectual, and you can have it with. So those are the categories. So that just is this week, the week of the 15th, is the health conditions without a developmental disorder. So we are doing our best to accommodate all of those requests for vaccines. We have them grouped by the categories, and when we open up a clinic, we take a little bit from each category so that we are pushing out the vaccine equitably and still checking off all the boxes of all the people that meet the criteria to be vaccinated. We're doing great with our clinics at Kent and at the city schools. We can accommodate 50 people at one time, which helps with the monitoring as well as staffing. We can get a lot accomplished with that. Anything else on the clinics?
Yeah, I think one of the biggest, messages, and I feel like we say it a lot, but I think we just have to keep saying it, is that vaccine supplies are limited. We're trying our very best, and as soon as we get vaccine on hand, we schedule a clinic, and we don't let vaccine go to waste, and we're being as equitable as we can. I do think there's a misconception that there's vaccine available, and there just really isn't at this time. So I just, I know this is public streaming, so I just want to make that point once again. It's not unusual for us to have a clinic at Kent and have people say to me, "Oh, do you have like 4 or 5? How many of these do you have scheduled today?" And I said, we don't have that much vaccine. We only have a couple scheduled today, or you're the only clinic scheduled today. And
right. And unfortunately, this week, because of the weather, our shipments have all been delayed. So thankfully, we try to backload the week with clinics as opposed to schedule them on Mondays and Tuesdays because of that fact. We don't want to have to then call 100 people to reschedule them on a different date if the vaccine doesn't get here. And then Chris mentioned the VMS, which is the vaccine management solution. It's a scheduling system that the Ohio Department of Health is pushing out, that they would like all vaccine providers to use, so that it's a kind of one-stop shop. So people would put in their zip code, find out who's vaccinating, what appointments are available, and then they can get scheduled. There have been some initial hiccups, I guess, with the system. They wanted it to go live on the 14th, and they're still working some kinks out. We, as well as many other health departments, have long waiting lists of people that have called weeks ago to be vaccinated, and we want to certainly honor those people that we have on these waiting lists. And we don't want to go live with a scheduling system that's going to allow people that just log on to their computer to be able to get a spot ahead of the people that have been on the waiting list. So that's something that the VMS system is looking into, how we can accommodate the people that have basically pre-registered with us. When we have vaccine, we then call them, get them scheduled. We don't want to go live with something and then not honor all of those people that we've been holding on to for, sadly, months.
Peggy, do you happen to know with the VMS, is there going to be any way that, let's say that, not that anybody there has time to do this, certainly, but could anybody call in, could you have a person who could like call into VMS and say, okay, you know, James Smith, this birthday, whatever, he wants one, then put in the next patient. Can you enter patients in on, you know, on their behalf?
You can, but from what training we've had, part of the registration process, there's a verification code. So it either goes to your email or to your cell phone. So that's one of the things they're also looking into, is provider offices doing the scheduling themselves, but then we've got to get that verification code to get the people actually on your schedule. So that's something they're trying to find a workaround where you could do it like an office software where you just schedule your appointments for the day, but they would like that piece of communication with the actual patient. So if there's a cancellation or some sort of hiccup, they want to be able to reach through them through the system, that we could say, you know, it's a blizzard, the clinic's canceled, and they send out a text message to the phone number on file for that person. So that's something they're looking into.
Because what about, I'm sure you've got patients who, especially you've got an 80-year-old who they don't have a cell phone and they don't have an email.
Right.
And I have a number of people that I'm thinking, how am I going to get them in that system? Because they don't have access even to a computer to do it, or a cell phone to get the thing. So that's why I wondered if there was a way for some of those people, we could just shoot names into that system and
We're
get them.
hoping, yes, that workaround will be there. And apparently that wasn't something that was thought of when the system was put in place.
Right.
So, you know, that there's a lot of health departments that's an obstacle.
Okay.
Right, and I know they're going to reach out to, you know, because now they're aware of this, I guess. And so they're going to reach out to, you know, district area on aging to, you know, help make this equitable, help people who, for us, it's not only people of age, it's people who can't afford it, don't have a cell phone, don't have an email, don't have a computer. You know, how do we make that equitable that everybody can sign up? So, you know, they're aware that that's a, you know, and in the South County, it could be the Amish who don't, you know, have that technology. So, yeah, Maria, you're bringing up some very good issues that are being all bubbling to the surface, and they're aware that we need some workarounds. So, you know, and I want this system to work. You know, we need something like this, you know, so I'm hopeful, but I'm also, you know, entering it cautiously.
Chris, is it working now?
Is it still in test environment? I don't know that, Peggy, if it's launched completely.
Live to the public.
It is or it isn't?
No, it is not.
Thank you.
They were talking today about, you know, they've had a request from health departments for a test environment. They didn't think to create something like that, so I think they're going to create something like that, you know. So, but for our big concern, we have concerns about registration, Maria, like you brought up, and we have concerns about, you know, honoring the people on our waiting lists. So, you know, we're going to try to work through that. And it's the same with the county health department. It's the same with Conneaut Health. It's the same with many, many health departments, you know, and, you know, this system will work well if we can work through these glitches and we can get everybody to use it, because then, you know, you can see within 20 miles of you who might have vaccine available on a weekend that you can go to a clinic, and it'll tell you whether you're eligible, you know, is you're eligible in 1B phases or whatever phase it is. So
another concern we have is the way the vaccine is rolled out and how we receive it. So it's very difficult to plan ahead in clinics when you have a short turnaround. The vaccine's going to arrive on Wednesday, then now logging into the system, setting up those clinics for the week, and then letting the public know. So essentially the public's going to have to keep checking in daily to see what's available in their area, because it's not that you can schedule out weeks in advance for your vaccine because we aren't going to know if we're going to have it. And then the other hiccup that we found in just kind of going through the trainings is scheduling for the second doses. That's not something that they thought through, that typically when we schedule somebody for dose 1, we schedule their appointment for dose 2, so that that's already made. Someone else isn't going to get this spot. So today's February 17th. We have Moderna. You're due back on March 17th. That's your 4-week appointment, same place, same time as you got the vaccine. System right now doesn't allow for them to schedule that second dose. So if we open up the March 17th clinic for the 50 people that we've done today, how do I know that Maria Fowler's not going to sneak in and take my spot for dose 2? So then we've got to accommodate to find spots for them. So there are, certainly some things that I guess the system didn't realize all of the intricacies and logistics of scheduling the vaccine. So they are working on it, and they're trying to make these, changes to the system that will allow us to, meet the needs of our patients.
I just wanted to add just the feedback from, I've had patients who have gone to your clinics at Kent, at the schools, and they're in the building you're in right now, and it's all been positive. I think that the way that you're doing it is so organized, and I almost wish that the state would have consulted a little more with the boards of health who were already vaccinating before they added these systems that they're requiring, because it was running very smoothly, in my opinion. And now, like I said, this wouldn't have happened before because you were just scheduling everybody as we were told in the beginning for their second shot, right? And now this, the system's I think, gonna buckle with all of these new requirements. But you are doing a really good job. I mean, like I said, everybody said good things about it. How quickly they're taken care of, no problems. It's really been good.
Thank you. That's nice to hear.
Yes, thanks, Maria. That's nice to hear. That really is. Staff has been working really hard. So I guess just stay tuned, guys. We just wanted to make you aware, when you hear the governor speak about this centralized system, what where we stand here locally, and we'll definitely absolutely look into it. But we've need some answers to some of our concerns.
Hey, thanks for that update. And I know most of you probably see me smirking, and I think I bit half of my lower lip off. The staff of the health department is being very, very kind in their words about this new system. I'll just put it to you that way, because as they were explaining it to me, I was asking all of those same questions, and I hardly know anything about this process. So yeah, it would have been really, really nice for the boots on the ground to have been consulted in this year's time that we've had to put together a system when we knew the vaccine was coming. So I'll stop there because I know we're all busy and have other things to do before Chris gets me in trouble for something else. Okay, so next on our agenda is, let me find it. Do we want to go to the environmental health report now? Or wait, do we have any further questions for the nursing report? Okay, I will entertain a motion to accept the nurses report. Motion by Terry and the second by Maria. Those were the first hands that went up. Any further discussion? All in favor? Thumbs up. Aye. Any opposed? Motion carried. Okay. Environmental health report. Do we have Terry? We have Terry. Okay. All right. You're up.
Okay, so for the monthly inspections for January, if you had a chance to look over the report that was submitted, it continues, lots of staff meetings, lots of conference calls with the state, lots of vaccination clinics. I've been helping the nurses in the clinics too, the big ones that we do 30 plus people, 50 people at Kent State in the and then inspections, routine inspections throughout the month. Also continuing, we had the new tattoo place open up in January on Main Avenue. And just one nuisance inspection. It was a sewer residence of a small building that was like a sixplex apartments were complaining of some odor. I scheduled a joint inspection with the plumbing inspector, and he noted some things that need to be corrected in their system in the basement to help with that odor. And that's it for January. Any questions?
Okay, no other questions there. All right, Terry, you're on mute. So we didn't hear what you said there. There you go.
This bed bug thing, is that the towers on West 48th Street?
There, you must be looking at the previous month, December.
Oh, maybe I am. I'm sorry. I'm a month behind.
It's okay.
All right, well, I guess that explains that. That's what I was sent.
Yeah, Terry, I'm just realizing that's what was sent out.
Oh, and well, that would be Angie.
I just now I'm realizing that myself. But yeah, these dates are all December. You're supposed to be reporting on January.
And Angie's on the phone, and
We could, Terry, here's a suggestion. How about we pause your report? I'll go on to mine. Maybe Angie could hurry up and send out the right information.
okay,
Okay.
I'll go and get her.
Okay, sorry about that.
Oh, I'm sorry, I didn't realize that.
I didn't mean to open up a big can of worms. I
No,
mean,
it's all right. I don't know. You know, Angie has everything in one database, and she must have selected the wrong month to send to you guys, is all I can think. Because Terry is reporting for, she is reporting for January, so.
I think that was the nurse's report that we were given too, was January of 2021.
Well, yeah, the nurse's report should be January of 2021. And
Okay.
Terry's report should be January 21, but her dates are December of 20 on her report. So it's a month off. They'll get you the right stuff. But I
Well,
can jump.
we should be reporting February though, right?
No, we're always a month behind because because we have complete data for
Gotcha.
January. We're only partway through February. So.
Okay.
But I'm happy to. Do you want me to go ahead with my?
Yeah, why don't we keep moving along then?
Okay, I will. So let me get to mine. So I just wanted to give you all an update on accreditation. So we did, as you remember, at last Board of Health meeting, we reported that we filed for a extension application to FAB. These are extensions that are being given to all health departments because of the pandemic. And that extension application was granted. So now we are awaiting our pre-site visit review. So they will take a look. What that means is they're going to take a look at all the documents that we sent them and look at, and that's all they're going to look at. And then they're going to open up some areas, I have no doubt, open up some areas and say, we'd like another example. We'd like additional documentation. This example is no good at all. Give us a completely different one. So the extension we filed for will just give us time to respond to that. So that's sort of where we're at. They have not, they supposedly were supposed to start that pre-site visit review on 2/9. So it's all virtual. We haven't heard anything more from them. So stay tuned. We'll see how it goes. It feels like so long ago that we submitted this accreditation paperwork. We're going to have to remember all the examples that we sent them. But the good news is too that they are allowing us to use COVID response activities for additional examples of our work. And Lord knows we have a lot of that to submit. So it's all good. Anybody have any questions on accreditation at all? Okay. I'll move on to the financial report. The financial report was sent to you really the biggest thing with, as we make our way through these weeks and months of COVID, is just, extra staff that's been hired, regular staff that's normally part-time, that's working full-time, overtime hours, all those things that have to be paid for. We're being told that more funding is coming our way, but I did want to call your attention to 3 grants that I'm aware of at this time. The VN 21 grant, which is $20,000, I did invoice for that on the 5th. The contact tracing 21 grant, $12,900. I am required to continually do that monthly reporting about our contact tracing activities. It's a little labor intensive, but boy, it gives us a lot of good data to refer back to. So we continue to do that. I'll be able to invoice for that when the grant is over on the 6th month. The EO 22 grant is starting in March, and it goes through next year, July of 22. It's for $52,953, and there is monthly reporting required with that. So those are some grant funds that I know are coming, and I am being told, that more funding is coming. So that's just what I know at this time. Does anybody have any financial questions that I can help with? Okay, I guess I'll move on to the COVID response report. So I want to give you some statistics. These were statistics that we gathered yesterday, so they are fairly fresh. For the city of Ashtabula, we've had 1,178 cumulative positive cases. So altogether, we were, as of yesterday, following 36 positive cases that were active. Currently in the hospital were 4 people. Altogether, cumulative hospitalization is 76. We've had 20 deaths in the city of Ashtabula, and we have released or symptoms resolved, people resolved and out of isolation, 1,090 people. Ashtabula County, as a total, all 3 health departments, are cumulative positives 5,788. Currently in the hospital for the whole county, 14 people. Cumulative hospitalized throughout the event, 461 people have been hospitalized due to COVID-19. We have unfortunately had 126 deaths. Symptoms resolved, people released 4,184, and active cases, as all 3 health departments were following, 218 cases. The positivity rate for last week was 10.2%, and that's right about where it was the week before. That is still a high rate. We are still in the public health advisory system. Our county is still red. We're still having a lot of cases, every day reported. So, that is what I wanted to tell you about the statistics. I do want to tell you a little bit about the vaccines that we've administered. So at the end of this week, we will have administered 1,910 vaccines. So, we are getting the vaccine out as soon as we receive it. Some of those are second dose vaccines. Some of those are first dose vaccines. So, we have to mix. We're keeping a lot of lanes open, vaccinating still people in the 1As, which are healthcare workers, people like that, vaccinating people in the 1Bs, which are all those age eligible folks and the people with congenital issues, and and then doing second vaccines for everybody that needs them. So, but I do thank Maria for her kind words about our clinics. The logistics of scheduling these clinics is much more difficult than you can imagine. I do have new empathy for for offices that have to schedule people. It's just very difficult. And, people want to cancel, want to move their appointment, want to, don't show up. So, there's just, a lot of moving parts and pieces, but we're doing our very best. And Kent State and Ashtabula Area City Schools they've been wonderful partners, just wonderful. The venues have worked out very well. People are comfortable. They can find them, space them out, clean, well lit, plowed parking lots, plowed sidewalks. I can't say anything more about it. It's wonderful. And even, utilizing the council chambers like we have been here in the city, I can get 20 people. That's the largest room we have in this building. We can get 20 people in there, and we do clinics there also. So we're pretty much having clinics every day of the week. One side or the other, either second dose clinics or first dose clinics. So I do want to talk a little bit about workforce. Jim and I have talked about workforce. With vaccine being so limited at this time, the workforce that I have seems to be working out well. Our contact tracers have been very flexible. Thankfully, we need less contact tracing, less isolation and quarantine management, and more help with this vaccine clinics. And they've stepped right up. If I ask them to please call this group of 50 people and remind them about their vaccine appointments, they're happy to do that. They've worked out well, and they've been flexible and nimble. And, wherever we need them, they come with us at times to vaccine clinics and help with the check-in process. They assemble packets that we need to take to the vaccine clinic. So they've been nimble and helpful, and, we really do value their help. We do have a RN that is a contracted RN that works on the weekends, and she has been wonderful. She does contact tracing, and she does clinic work with us too. But I am looking forward to when we have more vaccine, and how are we going to handle giving more vaccine. We don't have the workforce to handle giving much more vaccine. So, we are exploring different things. Jim and I have been in conversation about volunteers and, volunteer management and how we could handle volunteers, if that's even something that, could help us to, maybe hiring some additional help. So I just wanted to let you know it's on our radar. We have explored using the Ashtabula City Fire Department, the EMTs there. Our fire department isn't a very large department. They would have to be doing this help for us when it's their off hours, and we have to work with their union about that. So we've been in conversations with them too. So just, exploring it all. And, I know we've had offers of help, when volume increases from the hospitals, and we aren't the only providers. We've got, the FQHC is helping at Signature Health. We've got, the drug marts and the Giant Eagles and Maria's Pharmacy and, Hoffman's and, well, soon to be maybe.
We don't have it yet.
Not yet, but in the future, there will be more. So, I know that we're not going to be the only providers, but I would like to be ramped up to be able to do more. So we'll just have to see. We're going to work our way through it, and we're open to any suggestions you folks have. The only other thing on my report is just, the activities that I have done, had attended, and webinars and meetings and conference calls and things that I did in January. And of course, I go and help also, as being an RN, help with all those vaccine clinics whenever on the weekends and whenever they need help. So, it's a team effort. That's the end of my report.
I got a question.
Go ahead, Terry.
Have we got any kind of directive from the state as far as if this rolls out the way they anticipated to, this vaccine, as far as when this community is going to be allowed to have large social gatherings like street fairs, carnivals, that kind of stuff?
Well, Terry, maybe we can tag team on this. That that question has come up because, people are anxious. People are already asking questions about camping and day camps and fish fries and, gatherings. And basically the Ohio Department of Health, all the guidance that they issued last year is still in effect. They do promise that they will circle back and update that guidance, but they're basically waiting on the science. They're waiting on some data to inform that guidance. So at this time, we're just being very cautious because we are still, Terry, in a red county with high transmission, high spread. I'm grateful that our hospitalizations have come down. That's one marker, but we still have high spread. And to say it's a good idea to mass gather, I don't think I can go out that far and say that yet.
Chris?
Mhm.
I would just like to add, because I've been keeping track of things with the vaccine on my news feed and on some podcasts that I listen to. And one of the things that they talked about repeatedly on one of the podcasts is the vaccine, it can protect you it protects from severe disease, but not from infection, which means if I have both doses of the vaccine, I can still become infected with COVID-19. I just won't end up hopefully so sick that I'm in the hospital and maybe on a ventilator. But because I can still get the vaccine, they're starting to look now at how likely am I, if I'm vaccinated and get the vaccine, how likely am I to pass it on to somebody else? And it was either yesterday or the day before, I saw in one of my news feeds, people that have been in the vaccine trials are now being followed. And what they're doing is looking for the presence of virus in the noses of people who have had 2 doses of vaccine, and what's the level of viral load that those people have. And one report was that, and I can't remember which vaccine it is, but one report was that they're finding that people who had 2 doses of vaccine, if they became infected, actually had a lower viral load, less virus in their noses. So possibly they are less likely to be able to transmit it. But that's one report. So it's something that they're looking at, but we need to remember, this is why the CDC and Dr. Fauci are saying, even if you've had 2 doses, continue to wear masks because you can get the infection, you're just not going to get as sick. So, and like Chris says, stay tuned.
Thanks, Ruth. I think that really contributes a lot. Thank you very much. And that is basically, Terry, and I hope is a way of answering your questions. We just don't know. We don't know, how much virus could be carried in people's noses. Can this asymptomatic vaccinated person make vulnerable people sick with that amount of virus that they're carrying with them? And it's all being studied and it all remains to be seen. And that's why it's so important that we continue, even though we're vaccinated, till we get more people vaccinated, till we get more data, keep distancing and masking and not social gathering and, all those precautions that got us to the point where we're at. There's some light at the end of the tunnel and we want to keep marching that way. So, and I don't know, Terry, if you wanted to add to that at all, Terry, Colette.
I think you guys have said it all. And as soon as I hear something from the state on what we're going to do with campgrounds, marinas, public swimming pools, and all those social activities and events that we have during the summer, I will push that out to everybody.
Thanks, Terry. I mean, I just think at this point it's you're safe. If you've got to make an assumption, you might want to assume it's going to be as strict as it was last year. I hope some of it will be lifted, but we don't know that. Does that answer your question, Terry?
Yes, it does. I just, the longer this goes on, I think there's going to be a pushback, because people are kind of fed up on that. I hope that doesn't happen. But
Well, I think the reason we've extended it this far is because of the pushback that was given from day one. And that's why we're a year into this thing, because of, the Facebook world was smarter than everybody else. And when you see a meme, you have to repost it and share it, and it becomes gospel rather than actual science. So I definitely think we're always going to be battling that. It's kind of something everybody's in a holding pattern. I know that many of the events we do here in the city, everybody's kind of in this holding pattern. What do we do? Waiting for some guidance. And one thing, Chris, I wanted to maybe discuss a little bit and clarify. So there technically is not a stay-at-home order in place for the state of Ohio now that the 11 o'clock curfew thing has expired, right?
Yeah, I think that's correct.
Okay,
right?
so right now we still just have, business restrictions of capacity and things like that, but there, even though there isn't the stay-at-home order, it's still, advisable that if you go out, you're wearing a mask, if, still do the social distancing. If you don't have to, don't go out, stay within your unit, those types of things. But, even though that has now lifted, let's keep doing these things to kind of, stay in this right pattern of keeping the numbers low, and see what happens from there. Okay.
I have one more thing I'd like to add. Also, because we have some variants in the country that are more highly transmissible, the new recommendation is to go ahead and wear double masks.
Yeah, I have seen that. Yeah.
Oh,
Maria, did you have something?
Yeah, I just wondered what is the restriction on gathering sizes? Is there still is it still no more than 10? Is there, except for churches and funerals and stuff? I mean, is there?
Yeah, I don't know, Terry Collette, if you can comment on that. You're probably more up to date. I don't think it's changed at all. I think it's still at 10.
Yes, we're still at those guidelines, the 10 groups of no larger than 10, except for, those events, church gatherings and things like that. But still social distance, masking, and we're still following under the code, the red, for our county also.
And not just our county. I don't know if you've looked at the state of Ohio. It's basically painted with a red paintbrush. There are a few counties south that are orange, but it's painted red. And it doesn't take more than one or two outbreaks, in a congregate setting to trip that back up to purple or. So I know we all are so tired, but I don't want people to get discouraged. I'm very, very hopeful about the vaccine and just, all the things that we've done, we're making progress. So.
Okay. Anything else for the director's report? I will entertain a motion to accept that.
So moved.
Okay. We got, I think I saw Chris first and then Dave DeJord second. Any further discussion? All in favor? Aye. Aye. Any opposed? Motion carried. Okay, thank you, Chris. Terry, we'll go back to you. I know the report was emailed back out, so you're up.
Thank you. So Angie sent the January report out, if you had a chance to look it over. As I said before, lots of meetings, lots of conference calls, and then the routine inspections throughout the city of our food service and retail establishments. And then just the one nuisance on the sewer.
Any other questions for Terry? Okay, anything else, Terry? I think you're going to get off pretty easy this week, this month. So.
No, that's it then for me.
Okay, thank you. Entertain a motion to accept the environmental health report. Ruth, 1, Chris, 2. Okay, all in favor? Aye. Aye. Any opposed? Motion carried. Okay, thank you, Terry.
Thank you.
Any other business for the good of the board? I will just echo some of the comments already made in watching the staff work, at the different clinics that we have and hearing from the community. They're doing a tremendous job. I did come in this weekend and talk to both Chris and Peggy because, she's being very modest in saying the hours they're working. They are working a tremendous amount of hours. And my goal of that conversation was, what can I do to make you feel comfortable about going home and having a life outside of this right now? And I don't think people really understand the dedication that they're putting into this and our small staff here. So again, I very much appreciate our health department, Chris, your leadership and everybody's work down there. So hopefully things will continue to run smoothly. The state won't get in too much of our way to keep the progress going. And we will do our best to keep everyone informed and keep rolling things out. The one thing I did want to ask, and Dr. Bishop, maybe you can help weigh in on this, because I keep, hearing our Facebook experts keep saying, the flu is non-existent this year. But I have heard that we are starting to see flu as well. Are you starting to see that in your clinics and at the hospital?
I have not had a single episode of influenza in any nursing home or in my office.
Wow. How about, do you know as of how that plays out as a system, or?
I would check it. I can check for you, but I know it's minimum.
Okay.
It's minimum. We've had a couple of H1N1s.
Really?
Mm-hmm. But those come around every year.
Okay. Good to know.
I'm not seeing any though.
I mean, hospitalized influenza patients are reportable. Haven't had one reported to us. So, so that's the good part of the masking, the sanitizing. That's.
Yep.
And people not coming from China.
Right. The travel.
Yep. Okay. Thank you for that. Any other questions? Anything else for the good of the order? Okay. Thank you all for go ahead, Ruth.
I just have one question for Chris. So being the city health department, if somebody from South County is hospitalized at ACMC, the report still comes to the city health department that somebody was hospitalized? Is that how that goes?
It is where they reside. So it's not where they're hospitalized, it's where they reside. So if they're a Andover person, that would be a case that would be reported to the Ashtabula County Health Department.
Thank you.
You're welcome.
And I have one quick question about that I've gotten from patients. If somebody does not live in the city of Ashtabula, they live in, and just anywhere outside of that, can they schedule an appointment or try to get on the waiting list with the city health department?
So the answer to that is that the COVID vaccine is a federal asset. That being said, we would never turn anyone down. However, we do want to encourage people to go to stay in the area where they live. Vaccine is being apportioned by our population. So we've talked to the county health department and Conneaut's health department about this very topic. And basically, we'll serve anybody that is in the 44004 area code. Because we understand that it's just outside the city. It might be Saybrook, it might be Township. But if you live down in Orwell, we're going to suggest that you go to Jefferson Health Department. Or if you live in Geneva, the Jefferson Health Department is the department for you. And Conneaut the same. They're going to serve anybody in the Conneaut mailing within reason. We're going to try. But people, some people just insist on getting on our waiting list. And, we're not in the business to argue with people. We're trying to keep it that way. Does that make sense?
Yes.
Okay. Anything else? All right. Having finished the agenda, we are going to stand adjourned. Thanks, everyone. I'm guessing we probably will be doing it this way again next month. So watch for the reports and the invite for the meeting.
Right.
Stay safe and be well.
Wear your green at St. Patrick's Day next month. Bye.
Thanks. Bye.
Yeah. Bye-bye.